Have you ever been talking to a doctor and you just get this feeling like something's not quite right?
Oh yeah, like you're not being heard.
Yeah, or maybe you walk out and you're like, wait, that diagnosis just doesn't sit well with me?
I think a lot of people have either experienced that firsthand or know someone who has. It's so frustrating.
Absolutely. And that feeling of being dismissed or overlooked, it's a really big deal. And it's actually the heart of our deep dive today. We're going to try to understand the reasons behind medical bias and, even more importantly, give you some tools to advocate for yourself.
Exactly. We're not here to point fingers. It's more about understanding how this happens. And we've collected 6 real patient stories, really powerful ones, where people actually overcame medical bias.
Right. So we can all learn from their experiences.
And like always, we want you to dig deeper if you want to. So we'll be sharing all of our research sources with you at the end.
Perfect. Okay, let's set the stage here. Before we jump into those stories, what exactly are we talking about when we say medical bias?
Well, medical bias can happen in a few different ways. One is unconscious bias, where healthcare providers, without even realizing it, might treat patients differently because of certain characteristics.
So it's not always intentional.
Right. It's subtle, but it's there. Then we have institutional factors, like the systems in place at hospitals or clinics that can actually contribute to bias.
What would be an example of an institutional factor?
Think about how short those appointment slots are.
Oh yeah, you're in and out.
Exactly. That puts pressure on doctors to diagnose quickly, maybe missing key things. Staff fatigue is another one, sadly, can affect how carefully they listen. And sometimes it's just outdated ideas about how illnesses show up in different groups.
Like how classic medical research has mostly focused on men.
Precisely. And that means we don't always fully understand how diseases might look different in women.
Makes you think about who's most likely to be impacted by these biases.
The research is pretty clear on that. Women, racial minorities, folks with higher body weight, and those with chronic illnesses are all more likely to be dismissed.
And the consequences can be pretty serious.
Absolutely.
Let's look at some concrete examples from the research. Pain assessment really stands out.
It's crazy, but studies show again and again that Black patients often get prescribed less pain meds than white patients for the same conditions.
It's like their pain is not taken seriously.
Sadly, it can feel that way.
Yeah.
And it's rooted in these false ideas about their pain tolerance.
That's a huge problem. And it's not just pain management either, is it? Think about how women's heart symptoms are often perceived.
Totally. If a woman goes to the ER with chest pain, she might be told it's anxiety or hormones.
Instead of a heart problem.
Exactly. And that delay in getting the right test can be really dangerous.
Wow. These examples really highlight how widespread and serious medical bias can be.
Yeah.
To really grasp this, let's turn to those 6 patient stories we mentioned.
Okay, let's do it.
Each one shows how bias plays out in real life and, most importantly, how advocating for yourself can make all the difference.
They're so insightful. So we'll start with a 32-year-old woman who went to the ER.
With some scary symptoms, slurred speech and weakness.
And get this, they diagnosed her with anxiety and sent her home.
She must have been terrified.
I know, right? But over the next 2 days, she got worse. And eventually, they figured out she'd actually had a stroke.
Ah.
What's amazing is that she kept pushing for more medical attention because she knew something was really wrong.
So her self-advocacy might have saved her life.
It very well could have.
And this brings us to the takeaway for all of us. Trust your gut and don't be afraid to get a second opinion if you're not satisfied with the initial diagnosis.
Exactly. Our next case really brings home the issue of racial bias. It's about a Black man with sickle cell disease, and he was in the middle of a severe pain crisis.
Sickle cell pain is notoriously bad.
You're telling me. But the doctors, they accused him of being a drug seeker.
That's just awful.
I know, right? It's a classic stereotype. And this meant he had to wait way too long to get the pain meds he desperately needed.
The thing is, sickle cell crises are incredibly painful, and there are protocols in place to manage that pain.
You'd think those protocols would be followed, right?
Right. And that's what makes this case even more disturbing. His family actually had to step in and remind the medical staff about the hospital's own guidelines for sickle cell pain management.
It's a powerful reminder that racial bias can actually override established medical procedures.
And that we need to be really vigilant about advocating, especially when facing such deeply entrenched biases.
Absolutely. Okay, our third case shifts the focus to weight bias and how that can cause doctors to miss diagnoses.
This one involved a patient with severe abdominal pain.
And the doctor's advice.
Lose weight.
No tests, No further investigation.
Just lose weight.
Yep. This happens all the time,
It's
unfortunately.
like the focus on weight overshadows everything else.
Exactly. Luckily, this patient stood her ground and insisted on an ultrasound.
And what did they find?
Gallstones that needed surgery. Imagine if she hadn't spoken up.
It really drives home the point that weight shouldn't be the only explanation for your symptoms.
You've got to advocate for a proper workup.
Right, demand those tests if you need to.
Our fourth case takes us into the world of chronic illness. It can take forever to get diagnosed.
Oh, yeah.
This young man had been dealing with fatigue and joint pain for years.
And what did the doctors tell him?
Stress? They just kept saying it was stress.
It's so frustrating when you're told it's all in your head.
Totally. And it happens way too often with conditions that don't have obvious symptoms. But finally, this guy just had enough.
He pushed back.
He demanded blood tests. And guess what? Turns out he had lupus, an autoimmune disease.
All that time.
It really underscores the importance of not giving up. You know your body.
No.
If your symptoms are dismissed, keep pushing for answers.
Absolutely. Case number 5 brings us back to heart symptoms.
But this time, it's about how they can present differently in women.
Right. That's a critical point.
So there's this woman who went to the hospital with chest pain, and they thought it was acid reflux.
The acid reflux.
And they sent her home.
No way.
But thankfully, she decided to get a second opinion.
Smart move.
And the second doctor ordered the right heart tests.
What did they find?
She'd actually had a heart attack.
Oh, my goodness.
It really highlights how important it is to be aware that symptoms can vary, especially when it comes to something as serious as a heart attack.
It's scary to think how often women's heart issues might be misdiagnosed.
I know. So if you have any concerns at all, keep pushing for those tests.
Our final case is all about parental intuition.
A mom noticed weird bruising on her toddler.
Oh no, that's never a good sign.
Right. She was worried, but people were dismissive, like she was overreacting.
That must have been so hard to deal with.
I can't imagine. But this mom, she trusted her gut. She kept pushing for blood tests for her child. The test revealed leukemia.
Oh, that's heartbreaking.
This story is such a strong reminder that sometimes you have to fight for your loved one's health. Trust your instincts, especially when you're advocating for someone who can't speak up for themselves.
These 6 stories, they're all different, but they have one big thing in common. They show how important it is for patients to be active in their own healthcare.
You're not just a passive recipient. You have a voice.
So let's give our listeners some practical tips. What can you do when you feel like a doctor isn't taking you seriously?
First off, stay calm, but be assertive. You have every right to express your concerns.
What's a good way to phrase that?
You can say something like, I appreciate what you're saying, but I'd really like to explore some additional testing just to rule things out. Or, I understand this could be X, but I want to get a second opinion just to be sure.
Those are good. What else can our listeners do?
Write it all down. Keep a journal of your symptoms, when they started, how often they happen, what makes them better or worse, all of it.
Why is that so important?
It helps you track everything and be super clear when you talk to your doctor.
What about bringing your own research to appointments? Is that a good idea?
Definitely.
Yeah.
If you've done some research on your condition, make some notes and bring them with you. List your symptoms, maybe some info from trusted websites, questions you want to ask.
Shows you're engaged.
Exactly.
Okay, here's a big one. What if a doctor refuses to order a test you think you need?
That can be really frustrating. In that case, be polite but firm and ask them to write down their refusal in your medical record.
Interesting.
Sometimes just knowing their decision is being documented can make them reconsider.
Makes them think twice.
Exactly.
Now, what if you just feel constantly dismissed by a doctor?
You have the right to find a new doctor who will actually listen to you. Your health is too important to settle for someone who doesn't respect your concerns.
These are all great tips. It's about being an informed and empowered patient.
Taking control of your healthcare journey.
As we wrap up, what are the most important things you want our listeners to take away from this?
Well, first of all, remember that doctors are human.
They make mistakes.
They have biases, even if they don't realize it. It's okay to ask questions, to get clarification. You deserve thorough care.
And the second key point.
No one knows your body better than you do. If something feels off, if your gut is telling you something's wrong, don't stop advocating for yourself. Keep searching for answers and the right treatment.
Couldn't agree more. Now, let's get to the research behind all of this.
Okay, so for folks interested in those racial disparities in pain management we talked about, check out the Journal of Pain Research. They have tons of studies on this.
And to learn more about how heart attack symptoms can be different in women, the American Heart Association is a great resource.
The National Institutes of Health has some good stuff on weight bias in healthcare.
And if you want to learn more about autoimmune diseases like lupus and the challenges of getting diagnosed, the Lupus Foundation of America is a great place to start.
The CDC, the Centers for Disease Control and Prevention, has guidelines on stroke symptoms and how to recognize them.
And finally, for practical advice on being your own best advocate, check out organizations like Patients Rising and the Invisible Disabilities Association.
We'll put links to all of these in the show notes for you.
Perfect. Well, that brings us to the end of our deep dive. We hope this was helpful and empowering.
We'd love to hear your thoughts. Have you ever dealt with medical bias? Share your experiences with us.
And if you found this deep dive valuable, hit that subscribe button and turn on notifications so you don't miss any future episodes.
We'll be back with more deep dives into health advocacy and taking control of your health.
Until next time.